Hey guys, this is Eric with Freedom Physical Therapy. I'm going to talk to you today about, since it's September and it's Fall Prevention Month, I'm going to talk about a certain topic known as BPPV, or benign paroxysmal positional vertigo. So vertigo is a general term that is describing dizziness, a sense of whirling, or that your body's moving in space, or also loss of balance. Now, BPPV is a specific condition that causes the sensation of vertigo. With BPPV, what the actual mechanism is it's affecting your inner ear. So within your inner ear, there are 3 separate canals, and each of them are positioned in different angles. Now, the purpose of the inner ear is to help control your balance. When we move our head from side to side, when we make position changes, our inner ear is constantly talking to our brain and how our body's moving in space. And how that works is there's fluid in each of those canals. So when I turn from left to right, one of those canals is sensing that I'm actually turning from left to right. And then same thing looking up and down, and also rotation, so bringing your ear to your shoulder. Now with that, what can happen is those canals get a calcium deposit stuck in the canals, which affects how the fluid moves in the canal. And the reason why those calcium deposits get dislodged is it could be due to a fall. Some people are more prone to them, and this is what causes BPPV. And so the goal of trying to improve BPPV is to return the calcium deposit back to its original starting place, so that way it doesn't give you the sensation of vertigo. Now the reason why it's giving you the sensation of vertigo is because that crystal, that calcium deposit, is kind of floating in either one of those 3 canals. Now when you move your head again, you're getting a false sense of how your head's moving in space, and that causes a miscommunication from your inner ear to your brain, and sometimes it gives you the perception that even at rest, you're still moving, and that gives you that sense of vertigo. So with there's 3 different types of BPPV because there's 3 different canals. The most common one is the posterior canal, which helps with turning from left to right. Then there's also the horizontal canal, which is the second most affected. And then the last one is the lateral, which is, I think it's even less than 1% of people are truly affected. It's actually hard to diagnose that. With that, there are specific maneuvers that you can do with your head to help return that crystal back to its original starting spot. I'm going to demonstrate the first one, which is the posterior canal. And ideally, when you're doing this at home, I would prefer if you have someone there just in case, because with the goal of this treatment, it's going to make you dizzy. It might make your symptoms worse before it gets better. And also, it could also impair your balance for a little bit, and also can make you nauseous. So it's always recommended to have someone there, especially if you're trying this the first time, just in case you need some sort of support, because if you're still feeling very dizzy after doing the maneuver, you're not going to be able to move or get to where you need to be. So having someone there just in case is recommended. So for the posterior canal, I'm going to demonstrate different positions. But what you want to do is you're going to start in an upright position like this. So let's say the right ear is affected. You're going to turn your head to the right, and then you're going to lie down. I'm going to switch positions and explain, because you're going to have your head tilt off the table a little bit. So I'm going to turn around. Sorry, I'm going to do the left side. So what you do is you're going to turn your head to the left, and you're going to slowly lay down flat on the table. And then what you want to do is let your head sink down, and from here you're going to get fairly dizzy. And if that happens, that means you're addressing the correct side that is affected. So from here, what you want to do is hold this spot for at least 30 seconds because we're slowly moving that crystal. Now, as your dizziness subsides, ideally you don't want minimal to no dizziness before you switch positions. From here, what you're going to do is turn your head the opposite direction, and then same thing. You're going to get dizzy again. You're going to hold this position for about 30 seconds and really try to wait for the dizziness to subside. Once the dizziness subsides, the next position is hold this head position, roll your body to your side, and try to look down at the floor. Same thing, you're going to get dizzy again. When you're getting dizzy in each position, you know you're treating the correct side and you're doing the movements correctly. Hold for 30 seconds, wait till the dizziness subsides, and then from here, the last position is you're going to sit upright in a chair or on the edge of a bed. So very slowly sit yourself up. And then here, generally you want less dizziness. When you're having less dizziness in this position, you're treating the correct side. After doing the treatment for this, you want to stay seated for about 10 minutes. One, you still may be feeling shaky, but also we want to make sure that crystal is back and staying in that spot so it doesn't get dislodged again into either of the canals. The risk of that crystal getting into one of the canals is pretty high within the first couple of days after treating this, so you really want to make sure that crystal's in the right spot. And then same thing, generally some people do feel nauseous, so if you can, try to have something nearby in case you need to relieve yourself. Now, with this one is treating the posterior canal, which is the most common form of BPPV. For another one, the horizontal canal, it's very similar technique, but different positioning in regards to what head movements you do. So same thing, I'm going to set up my body in the same position by lying down. I'm going to treat my left side again. So laying down on my back. This time, rest your head on the table and turn your head to the left. From here, you're going to feel dizzy. Same thing, hold for at least 30 seconds and wait for the dizziness to dissipate. Once that happens, you're going to turn your head and you're going to look straight up towards the ceiling. So the difference from this one to the other one was you did a full head turn. Here, you're taking your time and you're looking straight up towards the ceiling. Hold for 30 seconds, wait for the dizziness to decrease, and then turn your head to the right, all the way to your side. Same thing, hold for 30 seconds, wait for the dizziness to decrease. The next position from here is you're going to roll all the way onto your stomach and get on all fours. This is pretty challenging, and this is where having someone there to help might be beneficial, just so you don't lose your balance. So from here, what I would recommend, similar to the other one, you're going to roll to your side first, and then slowly roll to your stomach, and then push yourself into all fours. Now from here, hold for 30 seconds, still looking down at the table, wait for the dizziness to decrease, and then from here, you go straight to a seated position. So from here, I'm going to sit on the edge of the bed. And then from here, same thing, the dizziness should be less. Now, still wait for 10 minutes just to make sure that crystal is settling in the right spot. Now, I treated the left side for both of those canals. If you're not getting dizzy, it sounds kind of silly, but if you're not getting dizzy as you're doing this, you may not be treating the right side, you may not be treating the correct side, and you may need to do it on the other side. Same thing, if you're not getting dizzy treating the other side, what I would recommend is going to see either your primary physician or also you can utilize Freedom Physical Therapy, and we can do an evaluation to determine if what you're experiencing is truly BPPV. Now, the signs and symptoms with BPPV is also vertigo, but also you mainly have your symptoms increase with position changes, so getting up and down from a lying down position, and also turning your head or just any kind of head movement. Generally, those kind of movements are going to make your symptoms worse. And as I mentioned before, please have someone there with you as you're doing this at home, just so you have some support and in case you need additional assistance, because it will make you dizzy and you can lose your balance while doing this if you're trying to get up and move around right after doing this kind of technique. Now, if you have any questions, please contact us at Freedom Physical Therapy or come in for an evaluation and we can do a further assessment. Thank you and have a great day.